Hi, my name is Jerry Hesch and I'm a physical therapist, and I am evaluating Scott. I actually initiated a little bit of treatment a little while ago, but I wanted to capture on film the blocked mobility in his AC joint. He was in a car wreck and pretty severe impact, and he doesn't recall the exact mechanism of injury. I can image him striking his shoulder against the window or against the door pillar. I can also easily image a reflex reaction to try to keep the wheels pointed straight, and that could certainly capture the force in the AC joint region. He does have soreness in both traps, and I just manipulated T3 and 4 that was stuck in right rotation, and that may contribute to that pain. I screened the ribs, all of them, in end range flexion, end range extension and neutral, and found no restriction. Screened his low back, briefly looked at his lower extremities, feet, ankles, knees, and hips, and looks pretty clean. And you can see that he's a firefighter, and he looks like a rather fit firefighter, at least at a glance, okay? And he does work out regularly. But this AC joint here that is stuck does not allow me to actually test the true mobility. You see, the scapula has lifted upward and forward on that side, so the right scapula is protracted, elevated and rotated and forward. So that locks up that AC joint. Now when I restore normal position of that, and I restore normal relationship of the clavicle in relationship to the acromion, at that point I can then block mobility at the acromion, and I can move the clavicle in a couple of directions and stress those ligaments and find out if this is a product of an existing hypermobility. He did have a grade 2 sprain, so he did have laxity in that joint right after the accident. And your accident was when?
7 years ago.
Okay, 7 years ago. Right shoulder grades really nicely. You cannot see a motion restriction in terms of all isolated motions, specific motions and combined motions. You just don't see it. So I'm going to just demonstrate a very simple spring test. You walk along the clavicle. You can spring the medial clavicle and inferiorly, and then the lateral clavicle inferiorly. And you may be able to see that I can take up the slack to an end point, and then I can add a little bit additional force, and there is movement. Same thing with the medial clavicle. Now when we do it on the left side, you can take up the slack on the medial clavicle, and yes, you can spring it. There is bounce, there is recoil. When you come laterally and you push inferiorly and you take up the slack, it takes up quicker than on the right. But now when I try and spring it for an accessory motion, it's not there. The same is true of the acromion. So you walk along the clavicle, and then there's a distinct change where you have to climb up onto the acromion. And I'm trying to take up the slack in the acromion. You see I can do the same thing. Beyond that, right now I'm doubling the force, I'm tripling it. I cannot create movement. Whereas on this side, the acromion is right here. I can take up the slack, and you can see perhaps that the excursion is much greater, and then I can spring it and return to that loaded position, and it recoils quite nicely. When I let go, the slack is no longer taken up. Okay? Now the other thing is that you cannot mobilize posteriorly. We're going to test the clavicle on this side. I can take up the slack, and then I can spring it, and it bounces repeatedly. A couple of bounces, and now I'm going to let go of the taking up the slack position. On this clavicle, I cannot take up the slack, and if you can't, and I'm doubling, tripling the force, then you know that you can't create motion. So now I'm going to come onto the acromion itself, and I'm trying to move it posteriorly. It's so stuck I can't take up the slack, even if I double that force. So we're going to stop filming shortly, and I'm going to then treat him to restore normal motion as best I can, and then we'll be able to stress those ligaments and see, how much integrity that there is in those ligaments. If I lay him on his stomach, you can also see that the scapula on that side doesn't spring inferiorly quite as much. And I'm sure it wouldn't spring medially either because it's come laterally a little bit. But we'll stop filming now. I'll treat him and we'll come back and we'll show the results. Thank you.